Hi guys, Dr. Alex St.Pierre here with the Vaughan Kings here at Totem Life Science in downtown Toronto. Today I'm going to be giving you the first of several videos which I hope to produce over the course of the year that are really going to help to give you some of the tools and strategies you need to stay healthy throughout the entire season. So my role with the team is not only to stay on the bench and give you acute care if you injure yourself during a game or during practice, but also to make sure that you stay healthy throughout the rest of the season. So my goal with these videos is really to combine some high-tech and low-tech strategies on how we might be able to go about doing that. So today, using state-of-the-art iCloud and GPS technology, I was able to locate the closest Staples store where I purchased this whiteboard and this dry erase marker. Hockey injuries generally occur in one of two ways. The first and most obvious is trauma or direct impact. This is often seen in knee-to-knee collisions, headshots, body checks, or impact with the net or boards. The second cause, and less obvious, occurs insidiously over time. Microtrauma, caused by a host of factors, gradually builds up to a point where the tissue can no longer withstand any kind of load and ultimately fails. This load failure results in strains or tears of hip flexors, glutes, hamstrings, groin, hip rotators, or a host of other tissues. Recent understanding of the complex interaction between the muscles around the hip has given us great insight into proper rehabilitation and prevention into many of these common hockey injuries. The two greatest predictors of injury are previous injury and asymmetry. These two seemingly independent concepts are actually quite related. When any tissue undergoes an injury, whether it be bone, tendon, ligament, or muscle, a series of adaptations occurs. Muscles may become weak and stiff, limiting movement around the joint. While these initial changes are ideal in preventing further damage to the injured area, its persistence can lead to a host of chronic problems. This initial stiffness can create compensations in the way that a player moves. If not corrected, these compensations can change the way a player skates, shoots, hits, and trains. While the initial injury may create stiffness and muscle imbalance around a joint, the alteration in the way a player moves can ultimately perpetuate it. This cycle places excessive and abnormal stress on various tissues, which may then lead to further injury elsewhere. As a result, glute weakness may become groin strain, hip flexor tears may become low back pain, and hip pain may become knee pain. Muscle tightness is a common sign of overuse, oftentimes caused by muscle imbalance. Many hockey players complain of a feeling of tightness in their groin or hip region throughout the season. While it's common practice by players, athletic therapists, chiropractors, and physiotherapists to stretch the tight area. However, this approach often only works to relieve symptoms in the short term. How many of you continue to stretch your tight hips with no improvement in symptoms, or even the feeling that they continue to get tighter? While stretching can be effective in the short term, it often fails to address a fundamental cause of the muscle tightness, which is muscle imbalance. We have to move away from this localized muscle approach to the management and prevention of injuries and adopt more of a systematic approach. Many of the previously described issues can be addressed with proper mobility, corrective exercise, and performance training. Current team training approaches often fail to consider this clinical aspect of conditioning. Exercise is prescribed and performed with little attention given to the quality of movement. As a result, technique is sacrificed for strength and power. While this may not lead to any immediate injury or damage, long-term deficits and muscular imbalances may inevitably lead to increased non-traumatic injuries. A strong focus on mobility training increases the range of motion of a joint through relaxation of the surrounding muscles. Once this relaxation has been achieved, corrective exercise combined with performance conditioning controls the newly found range and provides optimal force and power development. This translates into greater performance with less non-traumatic injuries during the rest of the season. The best approach occurs under the supervision of a trained practitioner and takes into account individual differences of players. However, I have included several exercises to promote hip health amongst hockey players at the minor midget AAA level. These exercises are selected to increase hip mobility and range of motion, in addition to strengthening the muscles best utilized during the hockey stride and shot. They can be performed daily or as part of a fitness routine, or as part of a warm-up or cool-down during games or practices. By no means is this meant to be a replacement for your current warm-up routine, but rather work as an adjunct. For best results, consult a chiropractor to get a thorough examination of the range of motion and function of the hips. Careful assessment throughout the season can promptly address any issues that may develop, preventing injury and time away from play. Best of luck, boys. The kneeling hip flexor mode targets tension in the front of the hip and in through the thigh. Begin in a half kneeling position like you're proposing. Tilt the pelvis ever so slightly, tucking it underneath the torso, bringing it into a more neutral position. Squeeze the glute on the downside leg and keep in a neutral spine and tall chest. Shift the body weight forward ever so slightly, feeling a stretch through the front of the hip. Avoid sloppy starting position. Bring the hip, knee, and ankle in line with one another. If you're wearing a belt, the belt should be level with the horizon and the belt buckle facing forward. You should perform 12 to 15 reps each leg. Now we'll target the groin tension with the adductor mobilization. Begin in a tall kneeling position with the knees beyond the width of the hips. Keep the spine neutral and place your hands on the ground in front of you. Keep our back and shoulders strong. Hinge at the hips, bringing the butt back down towards your heels. Feel the stretch in through the groin and inner thigh region. You can alter the position of the knees and feet to apply different lines of stress to the groin. The back, head, and neck should remain in neutral throughout the entire exercise. Avoid any rounding or hyperextension in through the spine, as we see here. Perform 12 to 15 reps at various knee positions. The supine bridge, or hip thrust is an exercise designed to encourage pure glute and hamstring hip extension, something which is severely lacking in nearly all hockey players. Glute-dominant hip extension spares the back and can reduce the incidence of groin and hip flexor strains. Place one finger on the lower border of the rib cage and another on the ASIS, which is the bony part and through the front of the pelvis. Push through the heels and bring your hips in line with the knees and shoulders. The fingers should not approximate or move away from one another, as such motions indicate the use of flexion or extension of the low back during the movement. These should be avoided. To best target the hips only, the fingers should not move. Once again, perform 12 to 15 repetitions each side. The same principles of a supine bridge are then applied to the hip hinge. This movement is the basis of nearly all exercises for athletic development, namely the squat, deadlift, kettlebell work, and Olympic lifts. Place a dowel or hockey stick across your shoulders and bring your elbows underneath the stick. Keep the spine neutral. Bend at the hips and slightly bending at the knees, bring your hips back and your chest down towards the floor. When done properly, a stretch should be felt in the high hamstrings and lower glutes. No extension should be witnessed through the back. Forcefully contract your glutes and return to the starting position by thrusting the glutes forward. Do not thrust the pelvis beyond the torso, and do not think about standing up. This cue often results in the use of the low back rather than the hips. Perform 12 to 15 repetitions. The side bridge addresses lateral stability of the core and lumbopelvis. This is essential during the hockey stride. To begin, line your side with the elbow below the shoulder and the feet staggered so that the top foot is in front of the bottom. Hinge up into position so that your body weight is supported by the feet and the forearm only. Stay strong through the lats to minimize stress and strain of the shoulder joint. For a less challenging version, support yourself from the knees instead of the feet. Perform reps of 6 to 8 second holds and build up your endurance from there. The kneeling hip flexor mode with rotation is designed to optimize trunk rotation symmetry between sides and is critical as hockey players tend to have a deficit between sides. Start in the same position as our kneeling hip flexor mode. Get a dowel or hockey stick and place it across the shoulders. Tuck the elbows beneath the stick to ensure good tension through the lats and reinforce the neutral posture. Slowly rotate from side to side. Try to make yourself taller as you rotate, an action analogous to twisting and pulling when wringing out a dish rag. This will attempt to avoid side bending or flexing to one side and maximize pure rotation within the spine itself. From the front, keep the hips and knees facing forward. The pelvis should remain a stable base, which the rest of the spine rotates from. Perform 12 to 15 repetitions per side. Besides having the coolest name of all the exercises in the warm-up, the dead bug focuses on creating good tension through our core while allowing for mobility and movement of the lower body. In this variation, grab a dowel or hockey stick, stay strong in the chest, and try to attempt to bow or curl the stick with your arms like you're snapping into a Slim Jim. Ooh, yeah! Bring your knees and hips to 90 degrees. Pushing through your heels, straighten the leg, bringing the heel towards the floor. Do not rest it on the floor. Alternate between legs and perform 12 to 15 repetitions per side.